it wiped me out for a week.
Okay.
And then,
With diarrhea?
not necessarily, yeah, that's with the cramping, and I call them episodes.
But is it more like pain and cramping?
Right, and the diarrhea.
And diarrhea. Okay.
But your body goes into this trauma.
Okay.
That's why I call them an episode, because you start sweating from the head on down,
and that lasted, you said, a couple weeks?
yeah, I can't really remember, because I had too many tragedies all in the same month. My daughter passed away, and I had shingles, and I had the colon thing, and
talk about not catching a break. I'm so sorry.
And then after that was over, I was good from October, whenever that happened that I don't remember, to January the 25th.
Okay.
I had a major episode again that was horrible.
Okay.
And
how long did that one last?
that was just like a couple days.
Okay. And when these happen, what do you do to make it better?
I don't do anything. I take medication he gave me, and as soon as I can get off the toilet, I go in and lay down.
Okay.
But
and it just kind of eventually works itself out?
Yeah.
Okay. Whenever you said in October you had the colon thing, what do you mean by the colon thing?
Oh, that's what I call my episodes. When,
okay.
When you go into the cramping spell and you're sitting on the toilet and you think you're going to pass out, and sometimes you do vomit. And
I thought you were talking like a procedure or something like that. So I just wanted to make sure. And now, so you take the Bentyl. Does the Bentyl help with the cramping? That little tiny pill, dicyclomine?
The only time I ever take the Bentyl is if I have an episode, I take that.
Okay.
The other pill he gave me that I can't remember the name of.
The Colazol?
No. Sounds a lot like my blood pressure medication. It's got lepine in it.
Dicyclomine.
Yeah.
That's Bentyl. That's just the generic name for Bentyl. So you do take that?
No, this is another one. This is an antibiotic for infection.
Okay, let me look at your med list. Doxycycline?
There we go. Maybe.
That would be the only one that's on here that...
Yeah, it sounds a lot like my blood pressure medicine.
Because your blood pressure medication is, you have hydrochlorothiazide and then you have amlodipine benazepril. And the GI medications are dicyclomine or Colazol, which is mesalamine.
Okay, so I don't recognize either one of those names because I'm on a generic, evidently.
Okay. Well, then I'm not sure, but either way, whatever you take, it's usually like just a one-time thing, and then...
It's for a few days.
A few days? Okay.
The prescription runs out.
Okay.
Or close to that. It's a strong antibiotic. And Bentyl's just a relaxer for your...
Bentyl's an antispasmodic.
Right.
The other one that he had given you that he'd mentioned in prior notes is Colazol, or it's a type of mesalamine, which is...
That's what I'm not recognizing.
Yeah, and that's for, that's one that is usually 3 times a day, and that's for inflammation in the colon.
Okay, but I take it twice a day.
Ciprofloxacin? No, you're allergic to that. All right, well that's fine. I'll see if he recalls what it is, but those are the only things that we have documented in here. Okay, so whenever you have these episodes, like how often are you going to the bathroom and having bowel movements and during that time?
During that time, could be 2 hours.
Okay.
I mean, you start in with the cramping, but it doesn't all come out at once. You're sitting there and your body goes into... That's what I'm going to ask my doctor about. It's like you go into a shock system because your head is sweating and you have to use towels and wash rags and...
Right.
And the next thing you know, you're sweating all over and you think you're going to vomit. Sometimes you do. just vomit phlegm,
Okay.
and you feel like you're going to pass out, and that's the scariest part.
Okay.
You think you could fall right over, you know, hit
Do you
your
feel
head.
like your heart is racing, or like your blood
No.
pressure gets real high, or anything like that?
No.
It's just okay. And then, do you notice any blood in the stools or anything?
Yeah, that's
her
what
episode.
that's what I call an episode. When I go into a major bleeding thing,
Mhm.
and that's why he gave me that thing you're calling. I don't recognize.
Okay. Could the cholazole, but that may not be what it is. Okay.
It's
And-
for a major infection. That's what it's for.
Okay. Well, I don't know. There's nothing on your list except doxycycline, which is an antibiotic, and the
Yeah,
other ones
that's-
wouldn't be used for it. So it could
Yeah,
be
because
doxy.
originally when I went to the hospital with the bleeding, he gave me the Cipro and the Flagyl,
Uh-huh.
and that I don't know which one of those I'm allergic to. That's why he had to go to the other one.
Okay.
Cipro and Flagyl are pretty strong, but I'm allergic to them.
Okay. And now in between these episodes, do you normally have like one bowel movement a day and it's formed and no blood and things are pretty regular?
Yeah.
Okay.
And I thought I was doing great from October to January 25th because I was doing that. I was
Yeah.
going every day, and I thought I was eating pretty normal, and then bang, that hit me. And then I had another one last Monday, April the 14th.
Okay.
But that was a small one. I didn't
Okay.
go into the sweating trauma mode.
Okay.
I figured.
So do you feel like this is happening more frequently than it was before, or is it
Oh.
about the same? Because that would have been 2, maybe 3 times in the last year since you've seen him.
Yeah, and maybe I feel like I thought I was really doing good from October to January 25th
Uh-huh.
because that was a long time for me.
Okay. I just asked because we had talked in the past about, is this something we need to like repeat a colonoscopy for, but at the same time, to have you go through a procedure, we don't want to do it unless your symptoms are really severe.
Well, I know he doesn't want to do a colonoscopy just because of my age.
Yeah, and that's what I mean, but unless there's something changed or it was getting worse or you're having everyday bleeding, something like that, then we should take a look.
All the
But
time I do the bleeding, honey, is if I have
just during those episodes.
right.
So,
And then I do the one pill and that for a few days, and that usually stops it.
okay, all right. Maybe you can look at whenever you get home and see if you can figure out which pill that one was.
I
So
know
then
what-
we can put
I-
it in your chart.
Oh no, I know which one it is. It's that one that's for an infection.
No, that's what I mean. Look at what the name is and call us and let us know so then we can have it in your chart.
Oh well, he has it in there.
It's not in your chart. I've been looking at your that's what I'm trying to say is it's not in there. It's not on your medication list. It's not in his notes. Unless it's one that's in there and you're not recognizing the name or it's, a different name for it.
Yeah, it's the only only thing that I take that is different when I take the Bentyl is the one that reminds me of my blood pressure
Yeah,
medication.
But that's what I'm saying. If you can look at the name of it when you get home
And call.
and then just call and let us know. So then we can know. And if it's not one that we have on your medication list,
Okay.
then we can add it in there. Just so that way in the future we don't have the confusion and stuff like that, because I want to make sure it's documented. If you call and need something, then we have that too. But
Yeah, I did
anyway,
that the last
how's
time.
your okay?
I did that the last time because he was at the Veterans Hospital when I had the one episode. I couldn't even get a hold of him because I have his cell phone number, and he didn't answer. That's the only time he has not answered me.
Okay. Well, he must have been busy scoping or something, I guess, huh?
Yeah, he was at the Veterans for 2 weeks, I think. Because I've seen him forever.
And let's see here. Let me just look at one thing and see if it's in this note. And has your weight been pretty stable, or?
Oh, I lost 30 pounds. When did I see Wendy? From October to. Anyway, I lost 30 pounds really fast.
Okay. And why do you think that is?
because when I had that spell in October, I basically was living off of hard-boiled eggs and chicken noodle soup or anything soft. And I wasn't hungry. I didn't have an appetite because I lost my daughter, and who cares, you know?
Yeah. And were you able to gain any of that weight back, or did things kind of level off and stop, or?
I'm sitting right now, maybe 3 pounds lower than I was at my lowest.
Okay.
So I've lost 3 more pounds,
Okay.
and I don't know how.
I did find a note from Sarah, his nurse, and it sounds like it's doxycycline is the thing that you had taken
Right.
during the episode. So that is the one that's on your list, and
Okay.
yeah, so it is the doxycycline.
Yeah.
So, okay, so let me just see here. Are you taking the balsalazide or colazole? That's usually the 3-time-a-day one.
Is that what valsalazide?
Uh-huh.
Is that what colazole is?
Uh-huh.
I didn't know. Yes, I take that.
Okay.
And I had quit taking that for a short time before the October spell, I think it was. Because I thought, this stuff ain't doing me no good. I still have my spells.
And now, do you think since being back on it, the ones that you have had, they've been a little shorter or more tolerable?
No.
Okay. It sounded like the October one was pretty bad, which is why I was just asking.
And so was
about
the 25th of January.
that. Okay. Let me just listen to this.
My daughter thinks it's some
Let me feel your belly. Somewhat.
gastroenterologist is supposed to solve all my problems. But it ain't gonna work after all these years, I know.
And the balsalazide, let me make sure we get that back on your list because it's not currently on there. And I don't know if it's.
Well, he gave me something once that was samples that was wonderful stuff. It was for like if you go overseas and have diarrhea and what have you.
Okay.
But anyway, it was so expensive that
Rifaximin probably.
it was out of the question. And
Is there generic for it?
no.
No, yeah, Xifaxan is the brand name, rifaximin is the generic, and even still, it's really expensive, even the generic is, so.
And there was something else I was taking at one point in time, and ended up crying on the phone over the CVS representative that was so stinking expensive. And well, anyway, he ended up calling me back, and that's when I got on the balsalazide.
Balsalazide, okay.
He said, Mrs. Coleman, I think I found something that might work for you.
Okay, well, I put that back on your list, so at least we have that listed too. And, you know, I'll see what his thoughts are on this, because like you said, you know, you've been dealing with this with him for a while, so, you know, I'll be back in with him in a minute and we'll chat a little bit more.
So are you gonna go into gastroenterology evidently?
Yes, I'm about to finish my fellowship, so.
Are you excited?
Yeah, it's been a long road, so finally finishing up with training, so.
Are you gonna work here?
I won't
maybe?
be staying here, I'm moving back to Missouri where my family is from,
Oh.
so, yeah.
They come and
Almost
move
done,
away.
just a couple more months.
So then I have a question just
Oh, yeah.
about her symptoms. You said if they weren't extreme.
Well,
I mean, I know she considers this to be extreme.
exactly, but then that's why I was asking about, you know, your thoughts on doing a scope again to look, because if this is the same as it always has been and you just deal with it a couple times a year,
Oh, it's more than a couple times.
you know.
Yeah.
But that's why I was at, because you had mentioned like 2 episodes or 3 episodes.
Because I'm trying to keep track of it,
Okay,
so.
then, but like if it's getting worse or if it's different, you're having weight loss, you know, those are the things that we might consider repeating a scope. even though, you know, as you said, he didn't want to do it because of your age, you're 80 years old. But if you're losing weight and you're having a lot of blood in the stools and having a lot of problems, it might be worth looking to make sure that we're not missing anything bad that we need to treat, you know, based on what we saw. So it just, I guess it's up to you how you feel, and if you feel like you're getting worse, you know, would it be worth going through that?
Something to think about.
So something to think about, but.
But also something to think about is if when you're old and your intestines are so weak, I say. I mean, if they do scope and nick it or something, you're done.
Yeah, I mean, that's why we weigh
why they wait.
That's why we weigh the risks and benefits of doing it.
Mhm.
And there's the risks of perforation during a colonoscopy are less than 1%.
I was just gonna say, surely.
So it's very low. It's more probably the risk of undergoing anesthesia.
Yeah, that's the real issue.
Yeah. So
You have a
it's
strong heart.
it's, you know, at the point where we stop doing routine screenings, but if you're having symptoms, we would still recommend doing the colonoscopy. Now, if you have inflammatory bowel disease or you have bad, you know, colitis associated with your diverticulosis, if you have, you know, Crohn's or ulcerative colitis, if there's something like a cancer, then those would be the things that we'd be looking for, because then your treatment would change based on what we saw.
I mean, everything you
So-
just named, she has, I think, right?
No,
Well,
Crohn's.
I was going to ask him about the colitis and the inflammatory bowel disease.
Yeah.
Yeah. But it looks like the last scope that you had was normal, but it's been like 8 years ago.
Oh.
So we
That's
don't
when I had
have
the diverticulitis.
right.
Okay.
So we don't really have any up-to-date information. I mean, if you have uncontrolled inflammatory bowel disease, then we should talk about
Yeah.
treating that. So that's why, you know, it might be worth looking with a scope.
And what's the difference in the medication?
Well, if it's really severe, then we would use like a biologic medication, which would be like an injection or an infusion.
Oh.
Yeah. Now
If
there
it
are
works.
some that are safer to take, that we want to avoid as we get older because of the risks, but there are some that are safer to take that are only gut specific, that only act on your gut for the inflammation, so it reduces the risk of other side effects like increased cancers and things like that. So, but, you know, we can't really focus a specific treatment unless we know exactly
in
what
there.
we're treating.
Yeah.
But with having the episodes that are that bad, with having blood in the stools, with having weight loss, personally, I would recommend repeating a colonoscopy to see exactly what's going on.
I don't think my weight loss was based on that, honey.
Well, and it may not be, but like you said, you're still continuing to lose a little bit of weight.
But I don't eat a lot either.
Yeah.
I mean, I just eat the wrong
But
things at the wrong time.
Again, you know, you're probably right, and it's probably because you went through all that stress, you're not eating well, maybe your appetite is worse. Can we say that for sure? And
It's getting better.
until we rule something else out whenever you're having blood in the stools and severe pains and cramping.
I see your side of it because you're a physician.
I'm
So
just,
what is your side? Just
you know.
fear?
No, I don't know, honey.
Okay.
I just don't think I've been going through this half of my life with and I've not ever lost weight before.
Right. No,
it's
I know.
just these are kind of the red flag things that make us say, you know, maybe there's something else going on. Maybe we're missing something.
Mhm.
You haven't had a scope in 8 years, so we don't know exactly what we're treating.
Right.
And so that's the only reason I brought it up. But why don't you think about it? I'm going to go talk to Dr. Valentine. I'll see what he thinks about it, and then I'll let you guys work it out.
Yeah.
All right, I'll be
Because
back.
I'm going to ask him about that. See, when I was 10 years old, a doctor told my mother she has an old person's disease. She has colitis. Because I had bowel problems when I was young.
Okay.
So I want to know what's the difference between colitis and just the diverticulitis, and
So-
why would they not know that?
Diverticulitis is whenever you get in
The pockets.
the pockets are diverticulosis. If they become impacted with stool, then it can block it off. It can cause what we call a microperforation, and it gets infected, and that causes inflammation, and then that's treated with antibiotics and it goes away. Inflammatory bowel disease like ulcerative colitis or Crohn's is a chronic ongoing inflammatory process that involves various parts of your bowel. If it's Crohn's, it can be anywhere from your mouth to your anus. If it's ulcerative colitis, it's only your colon. And it can be mild, it can be severe. You might have a mild disease at one point and later on have more severe disease. And if you have ongoing inflammation that's not adequately treated, that significantly increases your risk for colon cancer. And also for other problems like, bone disease or osteoporosis, increases your risk for like strokes and heart attack and things like that if you have really bad ongoing inflammation. But that's like over, a long period of time. So, yeah. But if things are controlled and it's in remission, then those risks kind of go back down, even though it's still slightly higher than the general population. So they are different mechanisms, and the ulcerative colitis and Crohn's disease is more of an autoimmune type of process where your body is kind of attacking itself and causing inflammation when it shouldn't. And the diverticulitis